I'm Brad Milkey, ABC News.
This portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield.
Joining us live on the KSL Newsline is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. And Doctor, we wanted to talk to you for a moment about this tragic case of the teenager who died from caffeine-related heart episode. And whenever I talk to anyone about this, they always said, oh, there had to be something else going on. It couldn't have been just caffeine. And yet, how do you understand what happened to this teenager?
Amanda, in this case, it seems like it was caffeine that really induced this heart-related episode. This unfortunate teenager was only 16. He's a South Carolinian. He consumed just 3 caffeinated beverages, consisting of a large caffeinated soda, a latte, and an energy drink. And it's thought that the high levels of caffeine in his system caused this cardiac event, and in which he just collapsed in the classroom and had to be rushed to the hospital.
What do you think people should look for here, Dr. Hiatt?
Well, Brian, caffeine is such a common stimulant. It's found in a lot of things that we consume, in coffee, chocolate, energy drinks, many soft drinks. It's taken by millions in this country every day, seemingly safely, but the death of this teen really highlights the need to be aware of the potential dangers of this drug. And we need to be aware that we're not all exactly the same. Some of us, as in the case of this teenager, may be more sensitive than others to the effects of this stimulant.
I want to ask you about the effects of gastric band surgery that have been questioned. This was in the news recently. Share with us a little bit about this, Doctor.
Yes, this recent longitudinal study revealed that gastric band surgery may not be the best method for weight loss. It was certainly a popular procedure when it was first approved way back in 2001, but since then it's been found that it really doesn't seem to do the job of helping people reduce weight. It also tends to have some complications such that essentially 1 out of 5 people who undergo this procedure have to have a reoperation.
1 out of 5, like 20%, 1 out of 5?
Yes, 1 out of 5, 20% of patients who had gastric banding have to have some type of additional procedure to remove or replace that band.
We've heard this phrase before, and I really hope I'm not being offensive when I say this, but the phrase "fat but fit," is that a real thing? Can a person be what would many people would consider overweight and yet fit?
Well, I'm sure there are many people who are overweight that are also very fit. They can probably, go farther than we can, than a person without obesity could. And also it's been thought that, that they could be medically fit and avoid contracting various chronic diseases such as diabetes, stroke, heart disease, and heart failure. Well, a recent study, Brian and Amanda, has actually pointed out that this may be a fallacy, that in fact people who may be obese may be at a greater risk of developing heart disease, stroke, and heart failure.
So even though you're able to jog or do things and that there's strength there, that there are also great risks. Is that what we take away from this?
That is correct, Amanda. Even though you may be fit, if you're more overweight than you should be, you may want to rethink this myth and actually try to cut that weight down, because by doing so, you cut down your risk of certain chronic diseases.
Dr. Hiatt, we always appreciate chatting with you. Thanks so much for your time this morning. This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield.